Welcome back, experts. Welcome back to part 2 of our discussion of 2021 E&M changes with auditing. Let's review the goals of part 2. Goal number 1, we will review the 2020 prolonged services. Number 2, prolonged services for direct patient contact. 3, non-direct patient contact. 4, we're going to introduce the new prolonged services code. And 5, we will talk about prolonged services for supervised clinical staff. Now, before we dive into it, let's go ahead and give you the address for the handout and the QR code. You can just take your phone, especially if you have an iPhone, you just click it, point at it and click your camera button, or some of you may have other types of phones. You're going to have to figure out how to use it, but if you have a scanner, you can just go ahead and scan it. If you don't know what to do, just take a photo of it and save it for later. All right. One thing that I want to, we're letting you know that there's a error, sort of, with your document from the prolonged services page and beyond. There are no page numbers. So if you have your copy, you want to go ahead and document your page numbers, you can. I believe you start with pages 11 through 16, I'm guessing. All right, so just to kind of help you navigate better, you might want to incorporate those page numbers. Now, let's get started in our discussion. As you can recall, we said that the guidelines pertain to the following: E&M office or other outpatient visits, code series 99202 through 215, and prolonged services, code series 99354 through 99359 and 99415 and 416 and 99XXX. I know you're saying it. Don't worry about it. We will review all of it. Now let's get started and let's discuss prolonged services. Prolonged services has 3 categories of codes. You have prolonged service with direct patient contact, without direct patient contact, and prolonged service codes for clinical staff that's supervised by qualified healthcare professionals and physicians. So just want to show you the code series for each. With direct patient contact, the code series is 99354 through 99357, without 99358 and 59, and your clinical staff that are supervised by physicians and other qualified healthcare practitioners, 99415 and 416. Now let's look at each of these individually to determine the 2021 changes. So let's begin with prolonged services with direct patient contact. All right, here is your code series 99354, and this is how it is. This is what these codes cover. So this code series covers the following. You have psychotherapy, consultations, home visits, inpatient visits, and observations. So as you can see, the code 99354 and 55, they cover psychotherapy, consultations, and other visits, other outpatient visits like home visits, but not office visits. And your 2 codes, 99356 and 57, They cover only inpatient and observations. Here is your chart on how you're to consider these codes. When you have less than 30 minutes, they are not reported. When you have 30 to 74 minutes, you use 99356 one time, 75 through 104 minutes, 99356 one time, and 99357 one time. And if it's more than 105 minutes or more, 99356 and 99357 twice. Now this is for code series 99354 through 99357. All right, now let's go ahead and look closer at this code language. If you see 99354, you look at it closely. This is for prolonged services in the outpatient setting. We are not talking about office visits. So except office or some other outpatient services, but pretty much this is outpatient services. And you might say, well, what do you mean? What else is outpatient? Well, you have psychotherapy, consultations, and home visits. All right, those are examples. And then 99355 is your add-on code for each additional 30 minutes. And pay attention to your parenthetical guidelines. Now, when you have 99356 and you're considering it, it's for inpatient or observation settings only. Again, these are not used for office visits. And your first code is for the first hour. Your add-on code is for, it says each additional 30 minutes. Remember, that means each 15 to 30 minutes. All right. I think you are ready. I think you're ready to solve your first scenario. Are you ready? Okay, experts, let's do it. Dr. Parekh, a cardiovascular surgeon, visited his patient, Mrs. Jones, in the hospital, who suffered an acute myocardial infarction the previous day. Dr. Parekh performed the stent revascularization and was following up with Mrs. Jones. The physician was concerned that the patient was showing signs that the stent may have dislodged. The physician performed a detailed history and exam with high MDM. The complexity of the exam necessitated an extenuating exam of 75 minutes of additional time. Code the encounter if performed in 2021. All right, experts, you have 1 minute and the time starts now. How did you do, experts? Let's see. Okay, so we'll put our scenario on the left and we'll get started. Well, the meat of this documentation surrounds what the doctor did. The doctor performed a detailed history and exam with high MDM. And let's go ahead and code for it. So a detailed history, a detailed exam, and high medical decision making, that's going to take us to code 99233. So yes, we are still using the hem. Why? Tell me, experts, why do we use the hem? Well, if you said because the MMM, the medically appropriate language, that applies only to office visits. All right, let's move on. So now in our documentation, we see that this exam necessitated an extenuated 75 minutes. So that means this is prolonged services. We know it's prolonged, it's inpatient, it's direct, face-to-face. So we are going to use that code series. So here is the entire series. We know that 99354 is incorrect because this is used in the outpatient setting. And if the parent is wrong, that entire family is wrong. And, this is a different conversation, but the parent code is wrong. So therefore, and the common portion language within that parent is wrong. That's the portion before the semicolon. So the whole family is wrong. All right. Now that takes us to our only two codes left. We have 99356. This is the correct family. And 99257, that's also correct. And here is why. This is the code for inpatient or observation setting. This is an inpatient setting. Now, if we go to our chart on how to code with our time, so we have 75 minutes of additional time, it tells us that we are to use codes 99356 one time and 99357 one time. Okay, right here it says 75 to 104 minutes. All right, so that's what we're going to do. And our final answer will be 99233, 99356, and 99357. All right, experts, how did you do? Did you get it right? All right. I know many of you did. And if you have a question, go ahead and type it in the chat. I am here, I am listening, and I am ready to respond. All right, let's review the final takeaways about this code series 99354 through 99357. Here they are. These codes are used for direct face-to-face encounters of prolonged treatment. They are used for facilities observation. They're used for certain listed outpatient visits such as psychotherapy, consultations, and home visits. These are not used for office visits. 99202 through 15, it's not used for clinical staff. 99415 and 99416, and it's not used for that new prolonged services add-on code 99XXX. And remember, all of these codes are add-on codes, so just keep that in mind. All right, so now that we've learned about prolonged services with direct face-to-face encounters, let's learn about non-direct visits. And I'm going to ask Mrs. Tracy to help us with that. Mrs. Tracy, please take it away.
Thank you, Mrs. J, for that overview of our prolonged services with direct patient contact. Now we're going to talk about prolonged service without direct patient contact. The codes for our prolonged services without direct patient contact are 99358 and add-on code 99359. Now, prolonged services is used for non-face-to-face encounters. They're used for inpatient and outpatient visits, observation status. But just keep in mind, these are not used for office visits, code range 99202 to 99215. Okay, Mrs. J defined earlier some outpatient visits for you. So these can be used for outpatient visits, but not used for office visits. And these can be used in conjunction with other related dates of service. Your keyword there is it has to be related. And 99358, as you notice there, is not an add-on code, so it can, in fact, stand alone. And these are not reported with 99XXX, which we will talk about later. And also, they are not reported with care planning. So those care management services, they are not reported with those. And here is our chart. Okay, this is our timetable for when we're dealing with a prolonged service without direct patient contact. If it is less than 30 minutes, keep in mind that that is not reported separately. 30 to 74 minutes is reported with 99358, 75 to 104 minutes, 99358 and 99359, and 105 or more would be 99358 times 1 and 99359 times 2, or possibly more for each additional 30 minutes. And these are the prolonged service without direct patient contact code descriptors. 99358 is used with a prolonged evaluation and management service that's before and or after direct patient care. So just remember, this is non-face-to-face, non-direct, and that would be the first hour. Now, 99359 add-on code is used with 99358 to report each additional 30 minutes. And then there's some parenthetical guidelines that we need to follow here. It just directs us on when to use these codes and when we do not report these codes. Okay, so we always say to highlight those. Those are very important guidelines directing us on how to use those codes. And just pay attention to that second parenthetical guideline. We do not report these codes with code 99XXX. We haven't really discussed this yet, but Mrs. J will be bringing in a great discussion on this code later. But just keep in mind, these codes are not used with that 99XXX code. And we use 99359 for additional time of 15 to 30 minute increments beyond the first hour. Anything that's less than 15 minutes is not reported, okay? So although this says each additional 30 minutes, just keep in mind that you would still use 99359 for each 15 to 30 minutes. Anything beyond that or less than that 15 minutes time beyond the first hour, again, is not reported separately. Okay, so you might just want to put a note there next to that add-on code. I have a scenario for you all. Are you ready? So I'll go ahead and read the scenario to you. We have Dr. Wilson visited Mr. Brown in the ICU of Mercy Hospital. The patient was admitted with MODS in sepsis with pneumonia. He also has end-stage CKD with diabetic retinopathy, Clostridium difficile infection, secondary lung cancer, and status post colectomy for colon cancer. Mr. Brown was not responsive for his history and examination as he was placed in a medically induced coma. Dr. Wilson performed a comprehensive exam with high MDM at the patient's bedside. The following day, the patient was weaned from the coma and was able to speak to Dr. Wilson via telephone. The doctor was able to obtain an extensive history. Due to the circumstances, the history was prolonged and took 90 minutes. Code for Dr. Wilson's services in 2021. Our answers here are going to be A, 99233, 99358, B, 99358, 99359, C, 99223, 99358, 99359, or D, 99233, 99358, 99359. I'm going to give you about a minute to give me the answer on this one, and your time begins now. Good luck, everyone. Okay, everybody have their answers. All right, so let's go ahead and take a peek at this one. And first of all, this patient was admitted, so this is an inpatient. And there was 90 minutes of prolonged time. All right, so let's go ahead and start looking at our codes and also take note of the comprehensive exam with high MDM. So if we look at the guideline here for prolonged service without direct patient care, it says that this service is to be reported in relation to other physician or other qualified healthcare professionals, including evaluation and management services at any level, okay? So your keyword there is in relation to, and this prolonged service may be reported on a different date than a primary service to which it is related. So if that's applicable, that definitely can be reported on a different date. And let's go ahead and look at our times for our prolonged service codes 99358 and 99359. So remember that 99358 is for the first hour and 99359 is for each additional 30 minutes. So I'm going to pull out the chart. This makes it so much easier. So if we look for the 90 minutes on our chart, the 90 minutes of time falls right here, and it tells us to code 99358 once and 99358 once. Okay, so if we look over at our answers, we have all of those codes in A, B, C, and D. So that's good. All right, so the next thing we're going to do is take a peek at those first codes, okay, in A, C, and D. So first of all, 99255 is an inpatient consultation. Right away, I know that's wrong because this was not a consultation. Okay, the next one is 99233. That's for inpatient initial hospital care. Now, was this an initial hospital care? It says that the following day, the doctor came in and did a bedside visit. So this is actually going to be a subsequent hospital care. So we're going to get rid of answer C. And we're also going to get rid of answer B because that is not coding for the bedside visit. That was performed the following day, okay? All right, so we're going to get rid of that one. And then finally, 99233 is the subsequent hospital care. And it looks like there was a detailed exam with high MDM performed here. That matches our two of our three key components. So we can code this as a 99233. And of course, we're going to also need those prolonged service codes that we already looked at on the last slide on that table, which is 99358 and 99359, okay? And there we go. That is our answer, answer D. So that's pretty straightforward. Now let's go ahead to the final takeaways about these codes, 99358 and 99359. These are used for facilities or other outpatient but not office, and also used for observation. They are used for non-face-to-face, so non-direct. They are not used for office visits 99202 to 99215. Also not used for care management services. They can be used in conjunction with previous or post-related dates of service, but your key is related. And 99358 can stand alone. Okay, so we're going to move on and we're going to talk about our next set of prolonged service codes. And these are our prolonged services with clinical staff that are supervised by a physician or qualified healthcare professional. So these are provided in the office or other outpatient setting, and they involve the clinical staff face-to-face time beyond the typical face-to-face time of the E&M service. All right, so let's go ahead and look at these codes. All right, 99415 and 99416. These are used by clinical staff that is supervised by a physician or qualified healthcare professional, and these are used in the office setting. So you do use them with those office visit codes, okay? And here is your table for your prolonged clinical staff services. If it is less than 45 minutes, it's just important to note that is not reported separately. If it is 45 to 74 minutes, you report 99415. If it is 75 to 104 minutes, 99415 and 99416 get coded. And if it is 105 or more, it's 99415 once and 99416 times 2, or possibly more, depending on if there is additional 30 minutes beyond that 105, okay? Here are the code descriptors. So again, 99415 is used for a clinical staff that is being supervised by a physician. All right, and this is for direct patient contact, and this is for the first hour. Now, just read your parenthetical guidelines. It tells you when to use 99415, and it's basically telling you for those office visits, and it's telling you when you do not report 99415. Okay, so you see some more prolonged service codes there, and you see that 99XXX, which we will be getting to shortly. And then 99416 is another, and take note that these are both add-on codes, so they cannot stand alone. Now, 99416 is each additional 30 minutes, and you list that in addition, of course, to your anything beyond that first hour, or in each additional minutes, 30 minutes beyond that first hour, and it can include 15 to 30 minutes, okay? And again, pay attention to those parenthetical guidelines under that code. Alrighty. And again, take note that 99416 is used to report 15 to 30 minute increments beyond the first hour. Just as those last set of codes we were looking at, anything that's less than 15 minutes is not reported. I have a scenario for you, and I'll read it to you. We have a 60-year-old woman is seeking help to quit smoking. She makes an appointment to see Dr. Lung for an initial visit. The patient has a constant cough due to smoking and some shortness of breath. No night sweats, weight loss, night fever, chest pain, headache, or dizziness. She has tried patches and nicotine gum, which has not helped. Patient has been smoking for 40 years and smokes 2 packs per day. She has a family history of emphysema. A limited 3-system exam was performed with moderate MDM carried out. Dr. Lung discussed in detail the pros and cons of medications used to quit smoking. Counseling and education was also conducted by the clinical staff for 45 minutes. Prescription for Chantix and tetracycline were given. The patient is to follow up in 1 month. A chest x-ray and cardiac workup was ordered. Select the appropriate CPT code or codes for this visit in 2021. All right, everyone, I'm going to give you 1 minute and your time begins now. Good luck. Okay, that is time. Everybody have their answers? Let's walk through this one. Okay, so let's look in our documentation. Let's see what's going on. It looks like we have history that's performed. Up at the top here, we have an exam. It looks like a limited 3-system exam performed. And take note of our MDM, because as we've learned, that MDM is very important. It's a moderate MDM. So we know we have a medically appropriate history and exam, and we have a moderate MDM. And it looks like there was some counseling and education that was provided to this patient by the clinical staff, and that time was 45 minutes. So let's look that up. We're going to pull out our table here, and it looks like if it is 45 minutes or longer, we're going to use code 99415 one time. Okay, and that's exactly what was performed here in our documentation, 45 minutes with the clinical staff. Okay, and we also are going to have to report the office visit. So which office visit code do you think we're going to use here? We know that this is an initial patient, so we're referring to our new patient office visit codes. And it was determined that there was a medically appropriate history and exam, and we're looking for a moderate MDM. So the moderate MDM is going to fall under code 99204 right there. Okay. So it looks like we're going to use 99204 and 99415 to indicate that 45 minutes of time spent by the clinical staff with the patient. And that's our final answer. So I know you all did a wonderful job on that one. Now I'm going to take you to our final takeaways for about these codes 99415 and 99416. So just remember, these codes are used with office visits, as you saw in that last scenario. They are used for the clinical staff who is being supervised by a physician or other qualified healthcare professional. Your keyword, clinical staff. And these are based on clinical staff time. Okay, so these are your prolonged services for clinical staff time. And that's it. All right, everyone, you did a wonderful job. And this brings us to our next discussion, which I am going to bring in Mrs. J.
Thank you so much, Mrs. Tracy, for that wonderful presentation on non-face-to-face and clinical team supervised by qualified healthcare practitioners and physicians. Outstanding. And experts, how are you doing? Okay, so you made it. We are at the final change. In fact, we really didn't specify what the changes were, and I'm going to do it at the end. So are you ready? All right, so I'm going to start now. One major change is that we have a new prolonged services code. Yes, this code is used with or without direct patient contact on a date of service or on a date of an office or other outpatient service. Definitely you use these with 992 1599205. And this is our new code, 99XXX. Yes, and here are the code's features. This is a new, we're going back. This is a new prolonged services code. This is used by physicians and qualified healthcare practitioners. These are used for office visits that are 75 minutes or longer. When it's 75 minutes or longer, when an office visit is 75 minutes or longer, it is considered a prolonged service period. That is a major change. And again, we only use this code with 99205 or 99215 on the same date of service when it's in the office. Now, let's take a look at the chart. It's pretty cut and dry. So above, this is for new patients. Anytime it's less than 75 minutes, you do not use this add-on code 99XXX. Oh, by the way, it is, and we're going to take a look at it. All right, so if you look at it, less than 75 minutes, you don't use it. 75 to 89 minutes, you do. You use it with 99205 and 1 99XXX. Yes. When the time is 90 minutes to 104, you use it with code 99205, and 99XXX will be used twice. 105 minutes or more, 99205 one time, and 99XXX times 3 or more for each additional 15 minutes. Now let's take a look at the established patient. If the encounter is less than 55 minutes, we do not use the add-on code. If it's 55 to 69 minutes, 99215 times 1 and 99XXX one time. 70 to 84 minutes, 99215 times 1 and 99XXX times 2. And if the time is 85 minutes or more, we use code 99215 one time and 99XXX times 3 or more for each additional 15 minutes. Now you might say, we have a time feature, a new time guideline for 2021, but let me be the first to tell you that if you have time, if your encounter is more than 75 minutes for a new patient and more than 55 minutes for an established patient, you do not use your time guidelines for office visits. You will use these guidelines, all right? And also in your parenthetical guidelines at the code level, it will tell you to use these guidelines in this chart. Now let's take a closer look at code 99XXX. This is the code for prolonged service with or without direct contact on the date of an office or other outpatient service. So these are pretty much for outpatient. And if you take a look at this code, it is a telemedicine code. It is an add-on code, and it is a new code. Excuse the color, but that's the color that they used, okay? Now 99XXX, this is the code for prolonged office or other outpatient evaluation and management services beyond the total time of the primary procedure, which has been selected using total time, requiring total time with or without direct patient contact beyond the usual service on the date of primary service, each 15 minutes, list separately in addition to codes 99205 and 215 for office or other outpatient evaluation and management services. Now, I do want to point out the parenthetical guidelines. You see, you use this add-on code in conjunction with the 2 office visits we just mentioned. And you do not use this add-on code in conjunction with those other prolonged services code. You don't use it with 993-5455, 993-5859, 415, 416. Do not report. Also, do not report 99XXX for any time unit less than 15 minutes. So we are going to use this add-on code for each additional 15 minutes or more. And I believe that's it. So experts, let's go ahead, let's test our knowledge, and let's go ahead and do a scenario. Are you ready? Okay, here we go. The 75-year-old patient arrives to his PCP's office after falling down the stairs over a week ago. He has extensive bruising and pain in the lower spine and hip areas. The patient had 2 previous laminectomies with fusion and most recently had a neurostimulator implanted. The patient suffers from chronic pain and COPD, but refuses to go to the ED because of risk factors associated with the coronavirus. The patient carried out a complex history, exam with high medical decision making. The physician spent a total of 90 minutes with the patient. Okay, experts, we have 1 minute to solve, and the time starts now. All right, so how did you do, experts? How did you do? Okay, let's see. So we have our scenario on the left, and below we have our code. We're going to go right to it. We're going to use time as the method to solve this scenario. And right below this code, 99215, is a parenthetical guideline. This parenthetical guideline says for services 55 minutes or longer, see prolonged services code 99XXX. We have a good situation. This is a great teachable moment because we've taught we've instructed in part one that when you have time, you just go ahead and use your time chart. However, remember, any time your code exceeds 55 minutes for an established patient or 75 minutes for a new patient, it is automatically considered a prolonged services encounter. So let's go ahead and look at the chart, the prolonged services chart, and let's go to the appropriate section of the chart, which is established patient, correct? Yes, this is an established patient because they say that this is the 75-year-old's PCP. So yeah, this patient has a relationship with this physician. All right, we're in the correct section, and the correct amount of time is 85 minutes or more. That is correct because our scenario is coding for 90 minutes with the patient, and we are directed to code as follows. Use 99215 one time and 99XXX times 3 or more. And or more will be determined by the number of units that are 15 minutes or more. So since we have 90 minutes, we only have 5 additional minutes and no further coding of X99XXX is necessary. Okay, so experts, if you said 99215 and 99XXX times 3, outstanding. And this brings us to our final takeaways about code 99XXX. Here it is. Remember, this is a new code for 2021. This code is used with office visits 99205 and 99215. This code is not used for clinical staff supervised by physicians and qualified healthcare professionals. And 99XXX replaces 99354 and 99355. All right, so this is great news. So I have some final thoughts about prolonged services. So let me just kind of summarize everything for you. If we look at all of the prolonged services categories, prolonged service with patient contact, without patient contact, prolonged services for supervised clinical staff, and our brand new code 99XXX. And remember, that is an add-on code. These are the differences, the distinguishing features between each. So if you look at the bottom, you'll see the differences. So this is a great opportunity to do a screenshot. I would encourage you to. So if you say, well, what were the changes other than that new code? Well, there weren't very many changes. The only change that we have is in the code language for 99354 through 99357, and that's it. So it pretty much excluded, it takes out the language for office visits. And the new code 99XXX actually picks up the office visits encounter. So these are the only two changes that we have for prolonged services for 2021. Well, congratulations, experts. We have reached the conclusion of the 2021 E&M Changes presentation. All right, now I like to bring my team back up, and we just want to tell you what a wonderful experience this has been for us, and hopefully you have, you're one step closer to 2021 E&M Changes proficiency. I hope so. So I'm going to ask Mrs. Tracy to come to the fore and help me close this out.
Absolutely. And most definitely, this has been an amazing experience. I feel so honored to be able to be here for these, to just talk about these E&M changes. It's been wonderful. You guys have been a wonderful audience. Thank you so much.
Yes, I agree. And you guys are fun too. So thank you so much for your participation.
That is right. All right, team. So for one last go, I want to tie in both parts, 1 and 2. So if you have documentation, you will, well, first, before we even get into that, the changes only pertain to office visits and prolonged services. That's it. Now, if you have an office visit, you have to look at the documentation and determine one of two things. Is this a total time based? Are we going to consider this based upon total time or MMM? MMM is the acronym for medically appropriate history, medically appropriate exam, and medical decision making. So let's start with total time. If we're going to consider based on total time, all you need to do is just code the total time documented. Now, if we're going to consider the documentation based upon MMM, remember the code is based on the documented medically appropriate history and exam. So in other words, whatever the doctor says, it's at the doctor's discretion. And finally, if you have to audit, only audit the MDM. That's it. Now for prolonged services, you have to determine if it's a direct patient, indirect patient encounter, or is it an office visit. If it's a direct patient encounter, you'll use code series 99354 through 99357. Indirect patient encounter, you'll use codes 99358 and 99359. And for an office visit, you got a couple of things going on. Don't forget that new add-on code 99XXX for 75 minutes or more for an established patient and, new patient, and 55 minutes or more for established patients. And don't forget about your codes 99415 and 416 for clinical staff supervised by physicians and qualified healthcare practitioners. Okay, I said that in one breath. All right, so if you want to screenshot this, experts, go right ahead. And then I'm going to turn it over to Mrs. Tracy.
Thank you so much, Mrs. J, for recapping our office visits and prolonged service encounters. Now I am going to recap our suggested steps to assigning an E&M code based upon the medically appropriate history, exam, and medical decision making. So first, we suggest that you inventory all diagnoses, signs, and symptoms in the documentation. Next would be to inventory all your procedures and services. And then next would be to determine the number of problems, data complexity, and risk, that is your PDR, using the charts. And finally, select or level code. So you would be selecting the code or using the E&M MDM leveling technique. All right, so now I'm going to hand it on over to Ms. Rochelle for the closing.
All right, thank you so much, Miss Tracy. And that concludes our presentation. I want to thank our amazing team for the great information that they shared today. Great presentation, ladies. And to each and every one of you who has joined us today, we hope that you enjoyed this presentation as much as we enjoyed our time with you. Thank you, and we wish you the absolute best. Enjoy the rest of the conference.